Hello everyone, welcome back to the final episode of Strike Out Stroke, No Act Recover. I'm Ben Uzair and today we're exploring stroke treatments, the path to recovery and the crucial support systems available. After understanding the signs and types of strokes, it's essential to know about the treatment options available for stroke survivors. Joining us today is Dr. Nadarajan Chandran, an expert in interventional radiology. Dr. Nadarajan, thank you so much for joining us today.
Alright, thank you for actually having me here, Ben. Alright, and it's very important that actually you highlighted on the stroke and the types of stroke. It's very important because we understand that when people talk about heart attack, everyone's aware of it. But when you talk about brain attack or stroke, the awareness is still pretty much lacking.
Absolutely, Dr. Nadarajan. Let's start with stroke treatments. What are the options available for stroke patients?
The main treatment prior to this is always thrombolytic and also for the ischemic stroke and surgery for the hemorrhagic stroke. But what I would like to highlight is another field called interventional radiology and how we can help in the stroke patients. As comprehensive stroke centers like ours here, we do have all three: neurologists, interventional radiologists, and the surgeons available. Okay, what the interventional radiologist does is that, especially in the cases where you have a large stroke, for example, large ischemic stroke because of a blood clot obstructed a very big vessel going to the brain, leading to one whole part of the brain is not perfused. In these particular cases, we do something called mechanical thrombectomy, where we put in a device to go up to the area which is occluded and remove the clot. But this is a very time-specific treatment where the patient needs to undergo this treatment within 6 hours of the onset of symptoms. So the patient have to come to the hospital which has the service within at least 2 or 3 hours, so we can initiate this treatment and do it. Second thing is that we also have this vessel which is occluded or vessel which is narrowed, which causes the stroke. So in these type of cases, we do something called stenting or angioplasty, similar to how you all see in the heart attack, where people go in and put a balloon to open up the closed vessels or put a stent to keep it open. So we do the similar thing for the stroke patients. But in the cases when you have the patient coming in with bleeding, alright, the treatment changes here. What we need to do in this type of cases is to find the cause, what causes the bleeding. And assuming the cause is something like a brain aneurysm, the swollen brain vessels, or abnormal brain vessels, the treatment tailored towards this. In the abnormal brain vessels, we're going to do something called embolization. Embolization basically means finding these abnormal vessels and closing them to prevent them from rupture and causing bleeding in future. Second thing is that we have something called aneurysms, the brain vessels which is swollen. In these particular cases, we do either a flow diverter or we put a stent across the occluding vessels. In some cases, we coil this particular brain aneurysm in order to prevent it from rupture or to stop the bleeding from occurring. So these are type of treatment which is very novel and very focused towards advanced care of stroke patients. So it's only found in areas which you have all these three specialists available and the services are provided, which is something like ours in Gleneagles.
Recovery after a stroke is a challenging journey. What are the rehabilitation methods available to aid in the recovery process, Dr. Nadarajan?
Now this is a very important part. We need to understand stroke is not a disease that occurs at one time and stops. No, it's a debilitating disease which has a very long progressions. Okay, these patients needs medical and social support throughout. And in the period of recovery, it very much depends on how much damage has been done to the brain and how much we can recover at the process of treatment. So what rehab does is that it tries to bring back as much of the patient's body functions, meaning that he can do the independent as independent as possible. So patient can go back to his normal living without a need of help of others. So he can go back and become a very good member of society.
Thank you, Dr. Nadarajan, for sharing this invaluable information. Viewers, remember, stroke survivors have hope, and with the right support and rehabilitation, they can significantly improve their quality of life. That concludes our Strike Out Stroke, No Act Recover series. A heartfelt thank you to all our doctors, Nasam Sabah, and all our viewers for joining us on this journey. Please share these videos with your friends and family to raise awareness and support organizations like Nasam Sabah. Together, let's build a community where every stroke survivor has the opportunity to thrive. Thank you for your time and dedication. And to our viewers, your support matters. Stay informed, stay compassionate, and let's make a difference. Goodbye, everyone.